Right now, the vast majority of doctors who are administering stem cells are doing it percutaneously, meaning they're just going through the skin tissue and injecting it directly into the joint space. They're basically just throwing it almost like a shotgun approach, just hoping this stuff sits there and goes to the damaged tissue. Now, the way I am applying it, despite the fact that there's not significant data, I offer it as an option for patients who've tried everything else. But what we do is we go in through the arterial system, through an IV, and I go in directly, a more pinpoint approach.
With the catheter?
Exactly, with the little catheter, and I go into the exact blood vessel that's feeding the area that's been damaged, the cartilage that's been destroyed. And so, again, do we have good data on this? We do not have large groups of patients out there who we've studied, but remember, this is an option for patients who have tried everything else. So usually the patients that I would offer this to is a few different patients. One, you've tried my other treatments, you've tried everything else, and now you're kind of at your end and you're saying, you know what, I don't want to get a big surgery, then it's not very harmful. There's very minimal risk involved with putting this biologic product directly into that joint space. That's one reason why I do it. The other way I might do it is if patients have a very focal fixed defect. Now, I do get some patients who have generalized arthritis of the knee, okay? They have very severe arthritis of the knee. And it's very important for the patient to know, and I already know this, but that biologic product that I put in may not work. So I'm not going to offer it to every single patient. You only want to offer these products to patients who might benefit the most from it, or the ones that we have in the highest theoretical benefit from it. So I think that's where it comes down to, because sometimes you go to a doctor, if you're willing to pay out of pocket, they'll just take everybody who walks in the door, take your money, and put that product in.